Thank you for joining tonight's telephone town hall meeting with Congressman Andy Barr. Congressman Barr will be joined by emergency physician Dr. Daniel Rodrigue. Dr. Rodrigue has nearly 2 decades of experience as an epidemiologist serving the Lexington community. In just a moment, Congressman Barr and Dr. Rodrigue will begin with a few remarks to give everyone time to join the call. This technology allows people from around the 6th District to join us live to ask questions from your congressman. If you have a question for Congressman Barr, please press star and then 3 on your phone. Again, that is star and then 3 to join the queue to ask a question. With that, I'll turn it over to Congressman Barr, first to update us on the federal response to the coronavirus, and then to Dr. Rodrigue to provide his medical expertise on the coronavirus.
Thanks, Tatum, and good evening, everyone. Thank you so much for joining us this evening for an important update on the response to the COVID-19 pandemic. Before I begin, I want to thank the heroic and selfless doctors, nurses, frontline healthcare workers who have put their own health at risk during this time serving patients and others. Their courage has really been on full display as we fight this novel coronavirus COVID-19 together. I want to thank so many Kentuckians. They're the unsung heroes during this period of dislocation in our society. Every day, doing great heroic things like the police officers, the paramedics, the firefighters, the grocery store employees, truck drivers, postal workers, bank tellers, sanitation workers, and the cleaning crews who, despite the danger that this virus poses to them, their sacrifice, their work is helping our community. And it's helping us maintain some sense of normalcy during these trying times. Since my last Teletown Hall, the U.S. Small Business Administration rolled out the Paycheck Protection Program, the PPP loan program, that provides cash flow through low cost and forgivable loans to Kentucky small businesses, in fact, small businesses all over this country. And in just 5 days, we've already pushed out $100 billion in forgivable loans to American small businesses as they face this economic shutdown during the coronavirus related episode in our country. This program was enacted as part of the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, which I supported and which was recently passed by the Congress. The PPP loan program has resulted, as I said before, in over $100 billion in what will likely be mostly forgivable loans to small businesses, basically grants, in just a few days. And those loans become grants when employers retain workers or rehire workers. And so the objective of this program is to incentivize employers to either retain workers or hire workers that have had to have been laid off as these businesses shut down because of the pandemic. This was a Herculean effort by the Small Business Administration and mainly by the U.S. Department of the Treasury to get the PPP loan program up and running during the short time frame. And it's a real credit to the private sector, the community banks, the credit unions, the lenders who really have led the way on this and fully implemented this program. The federal government's just not capable of putting out this kind of liquidity and cash flow into the community. So we've had to rely on and delegate the responsibility to private sectors. And we really their contributions to keeping our economy afloat during this time. Prior to the launch of the PPP, the Paycheck Protection Program, I led a letter to Secretary Mnuchin and SBA Administrator Carranza, and I was on the phone with Administrator Carranza earlier today and with Secretary Mnuchin earlier this week, asking them to implement the program with terms that allow lenders of all sizes, especially small community financial institutions, to have clarity and the liquidity needed to serve their customers through the PPP program. On Tuesday, I called for an expansion and an enhancement to this loan program to ensure that no small business and none of their workers will be left behind just because of a shortage of appropriations. Today, the Senate adjourned without an agreement to expand this program, which is disappointing, but I do expect that eventually we will be injecting an additional $250 billion into this program to supplement the $350 billion that's already been appropriated. On a brighter note, I personally asked Secretary Mnuchin to establish a liquidity facility to provide immediate funding to participating lenders so that they can continue to originate these loans without negatively impacting their leverage ratios, and before the Small Business Administration actually begins to purchase these loans. That's very, very important, so that these lenders can continue to push out this money to our economy, to Main Street America. Today, the Treasury and the Federal Reserve announced the details of that facility, which will grant the PPP loan program. Finally, I've created a small business response team in my office, led by Anthony Allen on my team. It's right here in the Lexington office. That team of staff in my office is available to guide both small businesses and lenders in the 6th District that have questions about this loan program. They're working with many small businesses and many lenders to help them interface with the Treasury Department and the SBA on any outstanding issues, so that they can onboard and get access to these critical emergency funds. As a reminder for all of those of you who are just joining the call, you can get into the queue to ask a question by pressing *3 on your phone, and you'll be put through to an operator, and you'll be placed in line to ask a question. Now, to give you a brief update on COVID-19 cases nationwide and in Kentucky. As of 3 p.m. Eastern Time today, Thursday, April 9th, almost 460,000 Americans had tested positive for COVID-19, with almost 1,600 cases in Kentucky. At this point in time, Kentucky accounts for less than 1% of all confirmed COVID-19 cases nationwide. This is a good sign, obviously, but it is vitally important that all Kentuckians remain vigilant and that leaders continue to prepare our state for more cases in the coming days. I've been working diligently to secure critical resources for Kentucky to fight this virus. This week, we received several updates that I'm happy to share with you this evening. This week, Kentucky will receive 15 Abbott ID Now platforms and 120 by the federal government. These testing platforms have the ability to produce a test result in as little as 5 to 15 minutes. And as Dr. Rodrigue will explain later on in the program here, that is really, really important. 120 test kits is not nearly enough, but it's good that we at least have the platforms, the actual testing equipment that's coming, and then we will be ordering, the state and the hospitals will be ordering from Abbott many of the testing kits, the reagents, the supplies, the swabs, in order to actually perform these rapid, high throughput tests. And these throughput tests are essential to preserving personal protective equipment for our first-line healthcare workers. One of the problems that Dr. Rodrigue will talk about is when we don't have fast result tests, many of our hospital workers will burn through, and their doctors, they'll burn through PPE, and that's one of the reasons why we have shortages of personal protective equipment. But on receipt of this good news from the U.S. Department of Health and Human Services, my office was immediately in contact with the governor's office, our hospitals, and Abbott Laboratories to help facilitate acquiring more test kits. Yesterday, I received clarity from the Centers for Medicare and Medicaid Services on the use of telehealth services in hospitals. And again, Dr. Rodrigue, our guest tonight, will talk about the importance of that, both in terms of bringing modern medicine to treating patients with COVID-19 or suspected COVID cases, but also to preserve PPE. They specified that telehealth restrictions do not apply when the patient and the practitioner are in the same location, like within a hospital. So to the extent the service can be done with telehealth, a Bluetooth stethoscope and FaceTime, that technology can be used within the hospital, and providers can get reimbursed for that. That is a big breakthrough. We've been pushing for that for weeks, and we really appreciate Seema Verma, administrator of the CMS, to ease those regulations for us and allow more telemedicine within the hospital. We've also been diligently advocating for clarification on other matters with CMS, but this telehealth expansion is going to be very, very helpful for patients and providers alike in confronting and battling COVID-19. These expanded services will aid in limiting the risk of exposure for healthcare workers and preserve valuable personal protective. We appreciate the thoroughness within which CMS has handled this. And Want to just also thank this week. But want to thank Dr. Rodrigue. I'll go ahead and move on to Dr. Rodrigue now. Dr. Rodrigue is an epidemiologist, and we are very, very grateful to have him with us. He's very busy, obviously, right now, and Dr. Rodrigue is an infectious disease expert here in Central Kentucky. He's actually done, not only is he tending to patients in our hospitals right now, but he's also training other physicians about this disease and educating other physicians on how to conserve PPE and also how to treat patients who are suspected for this illness. So at this time, I want to turn it over to Dr. Dan Rodrigue to give a few remarks.
Well, thank you, Congressman Barr. This is truly a unique time for us that have practiced infectious disease. I've been doing this for, I don't know, maybe going on 40 years, 20 years in Kentucky. And we've had our shares of new illnesses like HIV and Zika and all kinds of different things. But this, in terms of an outbreak, is truly unique in terms of its how rapidly it's spread across the world, the number of cases that we see, the impact is unbelievable. And I got to say, I'm so happy with the way Kentucky has come together to slow things down. We are not New York City. We're not New Orleans. We're not, some areas that really have gotten swamped with cases overwhelming the emergency rooms and the ICUs, the difficulties of taking care of patients if things get out of control like a wildfire. And I think we have done a good job so far trying to keep things tamped down as we work toward building up our capacity for testing and making sure we have the resources to take care of our patients. I mean, really kudos to all of us trying to work hard to do that. Behind the scenes, you just don't see what goes on, but for at least the last 6 weeks, people have been working day and night, putting in really long hours, with many people that you don't hear about, from the nurses to every division in the hospital administrators, trying to come up with ways to make sure that our patients do well. A lot of that stuff you just can't see. A lot of the alliances really go out the window. It's really all of us in this together. So there are phone calls being made from all different hospitals all over the city to try to make sure that we are as prepared as we can be. And we are now seeing the patients come into the hospitals, and we're working closely to treat them. But it's just it continues to be a challenge to try to get ahead of this so that we're not swamped with cases. Currently, as Congressman Barr mentioned, the caseload continues to increase. In Kentucky, it still is present in our communities, and all it takes is a wildfire to be touched off in a nursing home, and all of a sudden your emergency room or your ICUs are full. Well, we're not seeing that yet, and it's difficult from the public standpoint to hear everyone talk about the differing recommendations that have come down historically over the past month. And it confuses people, and that's understandable. This is new. This virus is new. It's not something we've seen before. And all viruses have their own unique capabilities. So how contagious this virus is, what it does to people, none of us have experience with that. And we're learning every week, every day, the different aspects of the virus, and then trying to respond to it the best way possible. So if you look at the news, look at the television, it always seems that somebody might be changing something this way and that way. But really, they're trying to use the best evidence available to make really difficult decisions. So things have changed. I mean, we went from 6 weeks ago, who would have thought that there was going to be a recommendation from the CDC to wear cloth masks? Well, that part of that was a change in understanding that the virus was more contagious than we thought, that there was a significant amount of transmission potentially occurring when people were not symptomatic. We didn't know that in the beginning. You had to gather the information and find that out and then make some recommendations. We've worked hard to try to increase the hospital's capacity and the state's capacity for testing, and clearly there's room to improve, but we have made strides, and so I'm more pleased where we are now than where we were a month ago. Same for our processes. There's a lot of processes for a patient to enter a hospital, whether it's through the emergency room or through other avenues, and a lot of it has had to be looked at critically to make sure that the patient gets the best care, that the healthcare workers are protected, that we're not infecting other people, and that takes some practice and some time, and we've had the opportunity to do that, and I think we're much better off right now than we were, again, a month ago. We still have cases ahead of us, and we still have lots of information that will change. If you go online and try to Google this, oh my gosh, there's probably thousands and thousands of articles, and it is difficult to sift through what is valid, how important is that article. But there are those that are really working hard at the university centers, at the CDC, at the WHO. They don't always agree point to point, but they're all going in the same direction in terms of trying to come up with the best options for the control of this outbreak, and also for the treatment aspects of the outbreak. So that will continue to change. I give lectures on this for the past month. Every time I give a lecture, I'll really have to date the slide, because in a week, some of those recommendations could change. Go ahead.
Well, thank you, Dr. Rodrigue. Thank you so much, Dr. Rodrigue, for those introductory remarks. I know we want to get to questions really quickly, so I'll get to those in just a minute. If you want to ask a question, press *3 to get in the queue. And just one other quick update before we move to questions, and that is that as part of the CARES Act, the Congress appropriated an additional $100 billion for hospitals. And the first allotment of that, the first $30 billion is going to the Public Health and Social Services Emergency Fund, and that's going directly to area hospitals, as well as $1.3 billion going to our community health centers. $3 million of the community health center funds will go directly to hospitals here in the 6th District. Finally, one other point, PPE, that personal protective equipment, that continues to be a major priority for us and a concern of healthcare providers. We worry about that shortage. Throughout this pandemic, we've been really focused coordinating with FEMA, the lead agency on the supply chain. We've also worked with HHS and the Assistant Secretary for Preparedness Response, which that's Dr. Bob Kadlec. He's in charge of the Strategic National Stockpile. We've gotten 3 shipments from the federal stockpile to Kentucky so far, but we want to make sure we continue to work with those federal agencies to make sure Kentucky receives the medical supplies and the personal protective equipment that our hospitals and our healthcare workers desperately need. As I said before, 3 shipments so far from the Strategic National Stockpile. That is the nation's largest stockpile of medical equipment, and that includes hundreds of thousands of respirators, surgical masks, of gowns, face shields, gloves that have been distributed throughout the state. Yesterday, I was on the phone with Admiral Polocek, who is leading the supply chain effort. There's 4 lines of effort there. One is preservation of PPE and recycling masks and cleaning masks, 20,000 cleaning of masks every single day. The CMS effort to get telehealth is part of that. The other line of effort is what's called Operation Airlift, and they're bringing in 80% of the supply chain is overseas, so they're actually taking government planes and bringing that PPE back and injecting it into the supply chain here in the United States. And then with the Defense Production Act, where we've ramped up domestic production, that's the 3rd line of effort. And the final line of effort is FEMA working with the 6 major medical distributors to get it pushed out to the hospitals and to the doctor's offices. The president also announced that because of his invocation of the Defense Production Act, 3M will produce an additional 55.5 face masks each month. And in the last 7 days alone, the FEMA air bridge system has airlifted these crucial supplies and protective equipment Cargo planes have delivered nearly 300 million gloves, almost 8 million masks, and 3 million gowns back to the United States. And our office has established a list of coronavirus resources on our website, barr.house.gov, for constituents to utilize to navigate government agencies during this pandemic. We recognize the emotional and economic hardship this pandemic created Kentuckians, but I'm confident we will defeat this virus, and we'll continue our efforts to protect our state and ensure that the American comeback is on the horizon. One update from Dr. Doherty, who is Dr. Rodrigue's partner. We have 75 new tests per day, fast turnaround tests that have been supplied by the University of Kentucky right here in Lexington. So that will help the testing situation as well. So with that, let's start with questions. And Tatum, will you take care of that?
Yes, thank you, Congressman and Dr. Rodrigue. Like the Congressman said, with that, we'll open it up for questions. Again, if you would like to ask a question, please press *3 on your phone to get into the queue. And now for our first caller, Tony from Richmond, you are live.
Hello?
Hey, Tony.
Can anybody hear? Hey, how's it going? Thank you for taking my call. I really appreciate everything you guys are doing. Listen every time you guys call and listen on the national front there. And my question is, we're a family of providers. My fiance is a nurse practitioner. She's working the front lines, and her sister is a nurse practitioner, and I'm also a pre-nursing student at EKU. And one of the things that's kind of come up in our household is we understand that there's a real burden on the unemployment insurance pipeline going on right now. Even the stimulus, we're not even sure when that's even going to come out and everything. And we know that there's other people that are more in need than we are. We are fortunate enough to, have some savings and everything. And, excuse me. And what we're really wanting to know is, has there been any talk on the Capitol Hill as far as incentives for forgiving the student loans of healthcare workers or providers, or possibly helping to pay down some of the really just the student loans.
Yeah,
that's kind of what we've been talking about lately in our household. So, any thoughts on that?
Good suggestion. And first of all, thank you and your whole family, your wife and your household for contributing and being on the front lines and putting your own health at risk. We really appreciate that and your commitment to the profession. There has been some talk of that. That's not been included in any of these packages so far. You mentioned unemployment, but we'll certainly take that back to the extent that we're looking at another fourth phase of this. Certainly, that makes a lot of sense. Let me just say this about unemployment. The CARES Act provides for an additional $250 billion and expanded unemployment insurance because we see the numbers. There have been an additional 10 million unemployment claims just in the last couple of weeks, and we expect that unemployment number to continue to go up. So it's appropriate that we surge assistance for the employed. But the PPP program, this small business loan program, is really designed to prevent people from having to go to the unemployment office, because we're incentivizing businesses and employers to retain workers, even if they're totally shut down and not in operation, not open for business, so to speak, or hire them back. And if there's been layoffs, we expect that this PPP loan program is going to incentivize employers to hire people back and keep them on the payroll for 8 weeks to bridge this situation. Dr. Rodrigue, would you like to comment on our healthcare workers and the burdens that they're shouldering right now?
Oh my gosh. I mean, I just gotta give my hats off to the nurses and the respiratory therapists, the physical therapists, the environmental, everybody that works in the hospital. They are under stress. It's a new illness. People are worried about getting sick themselves. That's a pretty normal fear, and really, it's amazing the work that they do in the hospitals. They're amazing people. And I know they worry about their families, they worry about their own health, and they're still moving forward. And we're trying to deal with some of that fear by education, trying to educate them as in terms of the best way to protect themselves in the hospital, using PPE correctly, trying to make sure we have the right environmental controls and administrative controls set up in the hospital so that all of us stay safer, whether it's healthcare workers, patients. That's one of the reasons some people wonder why we have restricted visitor access. Part of the reason why is there's significant potential risk for asymptomatic visitors to bring the illness back into the hospitals and affect other people and healthcare workers. But despite all this, they are still showing up to work. They're taking care of your mom and your dad and your grandfather, and really, but they're humans, and like all of us, they have some anxiety about what's going on. But they're still showing up to work every day, and my hat's off to them.
My hat's off too. And you asked the question about the recovery rebates, just for folks who are interested in information about that. Individuals who make up to $75,000 a year with a valid Social Security number will receive in about 2 weeks a check for $1,200. That'll be direct deposited in your bank account if your bank account is on file with the IRS. For couples, it's $2,400 up to income threshold of $150,000 in annual income, joint income. And for every child that a family has, an additional $500 per child. And those checks will ultimately phase out at $99,000 for an individual and $198,000 in joint income for couples. If you don't have your bank account on file with the IRS, or you're not a Social Security beneficiary with information already, an address on file with the government, there will be a website where you can IRS fill out your information, either a bank account or your home address, to receive a check in the mail. And if you prefer, the IRS is also preparing prepaid cards, so you can get those too in order to receive your payment.
Okay,
Tatum, let's go to the next caller.
Is from Tanya in Lexington.
Hello.
Hey, Tanya.
Hey, Andy. Thank you so much for doing this. My question is pertaining to the SBA loans. Our family, we have a small loan. We had someone help us fill out the application and get in queue. And one of the things that was brought to my attention, and I'm not sure how true it is or what the stipulations are, but is the repayment on those like 18 or 24 months? Am I correct in understanding that? Because I'm just, as we're going through this season, I'm like, I don't see how. My biggest concerns are payments and not being able to produce the kind of revenue to repay things, to pay things. So.
Totally understandable, Tanya. And if it's the Paycheck Protection Loan that you're referring to, yes, the amount of the loan, you can adjust with your lender, with your bank or your credit union, whoever you're working with, the amount that you're going to apply for. And what you need to know about that so that you don't have a big balance. And you're right, it's a 24-month it's a 2-year term. The way the regulations are set out, it's a 1% interest rate. So it's a super low interest rate over 2 years. But the thing that you have to remember is it's totally forgivable if you use the proceeds of that loan for the right things. So if you use it for payroll, utilities, your rent for your business, or mortgage interest, then that's forgivable. 75% of the loan has to be used for payroll. And in order to trigger the forgiveness feature, you have to retain your payroll for 8 consecutive weeks from the date of the origination of the loan. So depending on how many employees you have to keep those employees on the payroll, pay them with the proceeds of the loan. If you do that, it'll be 100% forgivable and you won't have a bounce. But you may have a bounce, you may need a bounce to tide you over. And so what you need to know about that ahead of time is it's going to be a 1% interest rate, a 2-year term. There will be a deferment of when you have to start paying back that loan for 6 months. So you don't have to pay any interest or any principal back for 6 months from whatever is the unforgiven portion of your loan.
Okay, that very much helps. Thank you.
Thanks. Good luck.
Okay, our next question is from Vicki in Paris.
Hello, Vicki.
Hello. Hi,
Hey,
how are
Vicki.
you today?
Hope everybody's okay in Bourbon County. Beautiful day today. I'm sure.
It is a beautiful day. Andy, I've got a question regarding normalcy. When we look at what's happened so far, there has been a disconnect between state government and federal government in many states. We've been extremely fortunate here in Kentucky. We have an exceptional governor who's been on task, and we're really pleased by that. Whether you're Democrat, Republican, Independent, I think we can all agree he's done a wonderful job. On to that, I want to know what type of, we will get through this, and when we finally get through this, what kind of plans does the federal government and the state government have for getting us back to some form of normalcy after this is all over?
That's a really good question, and I do want to have Dr. Rodrigue comment on that because we are really relying on the expertise of our epidemiologists. And at the federal level, Congress is really, and the administration, relying on the advice of Dr. Deborah Birx and Dr. Anthony Fauci, who is the head of infectious disease at the National Institutes of Health. They've really guided us in the development of the CDC guidelines, the 30 days to stop the spread, or slow the spread. The way these work is, and we're actually using federalism as an asset here. Obviously, this virus knows no boundaries, no geographic boundaries, but there are hotspots. And this is a big country. So what the federal government has done is put out guidelines, and using federalism, using state and local governments then apply those guidelines in varying ways based on their actual personal situation, so that it meets their individual situation. In terms of reopening, my personal view is that we need to reopen the economy as quickly as we can, but only when it's safe to do so, so that the public health requirements will dictate this. This is a very unusual situation where the government has intentionally shut down the economy for the purpose of responding to a public health emergency. And so when we can get to a place where we have a sentinel surveillance system in place, much more rapid testing, maybe a therapy in place, and where we can actually do mitigation a little bit better than we can now, and where you have a consistent decline in new cases, that's when we can start reopening the economy. I think that's going to be sooner rather than later, but I do want to have Dr. Rodrigue comment on that.
I mean, that's the $64,000 question that everybody asks Dr. Fauci every news conference, and the answer isn't the same for every state. I mean, what happens in New York might be different than what happens in Kentucky in terms of timing. So a lot of this will depend on, right now in Kentucky, we have not seen a huge surge. We are working on building capacity so we don't end up like New York in terms of getting swamped. But we don't know the degree of susceptibility in our population. We don't have approved therapies, vaccines. All those things will be important, as well as a good serologic test that kind of ends up showing us what percentage of the population is susceptible, and then trying to fashion a response in terms of getting back to work. All that I know is being done on a high level where they're trying to model how to reopen. So for now, it is looking at the rate of increase of cases, what the susceptibility of the population is, where you are with your resources. And we're still needing to improve the access to rapid testing, and we probably will not have a vaccine available for 12 to 18 months, at least safely rolled out. So I would imagine it's a combination of all that. Dr. Stack and Governor Beshear, Dr. Fauci, Dr. Birx, all kinds of folks are going to be involved trying to fashion the parameters that allow for successful reopening. And it may not be the same for every state. It really depends on what is going on in your state.
Good question. Thanks for that. Next
Okay,
question.
our next question is an online question from Jennifer, and she wants to know if Social Security recipients will receive a stimulus check.
The answer is yes. If you have a valid Social Security number, you will, and you meet the income guidelines, you will receive a recovery rebate. And for Social Security beneficiaries, you will receive that rebate in the same form that you receive your Social Security payment. So if you get your payment by a physical check in the mail, that's how you can expect to receive your recovery rebate. If you have it direct deposited into your account, you can expect to receive it that way.
Thank you. Our next question is from Etta in Irvin.
Hey, Etta.
Hello. Thank you for taking my call. I haven't written this down, so I don't want to wander away too much. Is there any way we can stop people from going out to eat or to buy clothes and things like that they don't really need right now? I mean, my pastor went by a restaurant the other day that the parking lot was full. That meant people were eating inside. What's wrong with takeout if they have to go out to eat?
Well, thanks for the question. And Dr. Rodrigue, can you talk to our listeners and online the importance of social distancing and why that's important with this particular pathogen?
Well, it's clear that large get-togethers can lead to the spread of something and the death of somebody that might be your friend or your neighbor, and oftentimes most of us just don't think about it till it happens to us. But there's plenty of stories around. There's plenty of published literature around. If you go to cdc.gov and click on the MMWR, one of the most recent descriptions in something that came out last week was tracking the impact of two family get-togethers in Chicago, where it seems like fairly innocent get-togethers, but they can track cases and then eventual deaths of people that were related to that get-together. When they track the cases, one person infects another person infects another, and then all of a sudden you have people dying in the ICU. But until it happens to you, a lot of times you just don't think it's going to happen. And all of us got to buy into that.
Well, thanks, Dr. Rodrigue, for that perspective. And I'll just share with you, I asked the very similar question to Dr. Anthony Fauci one-on-one. And I just said, there's a lot of concern about shutting down this economy. And what he said was, it is true that younger people generally do better with this virus, although the statistics are coming back that 10% of the fatalities from this disease in the United States are under the age of 44. So some young people do succumb to this illness. But nevertheless, even if younger people or healthier people do better, they still can become vectors, and they can infect older people. They can infect people who have compromised immune systems. And so because of the level of contagious nature of this thing, it can be very dangerous, especially because you can shed the virus and spread the virus even though you're asymptomatic. And that's why it's a particularly dangerous situation.
Thank you. Our next question is from Larry in Berea.
Hey, Larry.
I have a question for you. I guess maybe you can give me the short kind of the short answer here because I know that there's a long one. My question is well, I got a couple really, but primarily the PPP money. Of course, the president talks about how that money's all out there and it's gotten out, and of course you hear all of the nightmarish things about Wells Fargo, Bank of America, and you have to have a loan with them before they'll even hear you. They'll even talk to you about the PPP loans. So what I'm curious about, and I'm working with a local bank, a small community bank, finally, to do this, and they've been really helpful. And I'm just wondering, is the money actually starting to get to the people? Are you hearing in Washington that this money is actually starting to get to folks? Because I was watching Fox, and one of the guys on Wall Street said that he hadn't spoken to anyone that had received the money, and there are several people that you hear talking about it, and they all say that this money is not out there yet. That you can do the loan, but you just can't get the money. I guess it's bureaucracy, red tape, or something like that. But I'm kind of concerned about that. And then the other question, and I don't know if you'll know specifically the answer to this. We all know that the money, if it's used for payroll with the PPP, that it is forgiven. You don't pay it back. But here's a question I have: does that money have to be for employees who are currently not working, or can it be used for any employee?
Good questions. So the first, and I've been working on this issue on the implementation very, very closely. So the answer to the first question is that in a few rare cases, the money is the loans have actually already been funded. The loans have been funded and the cash is in the hands of the employer. But that's not the case in the majority of situations right now, because the first wave of this is getting the loans originated. And then the second wave of this is closing on the loans. So you will not actually get, if you've applied for one of these PPP loans with a community bank, and by the way, we couldn't do it without these banks around the country, these community banks, and they're doing really great work in implementing this program. So you're right, most of the small businesses don't have it quite yet, but it's going to be a matter of days. And some small businesses are going to start seeing that money today and tomorrow. But it could be that if you've, the regulations came out on this yesterday. If you had a loan that this community bank originated, processed, and if you got it approved, but yet you still haven't seen it funded, they have 10 days to close. So you can receive it within 10 days, no longer than 10 days from the moment that they approve the loan. So you can go back to your lender and find out the day in which it was approved, and you will get the money, and you have to get the money. They have to close on the loan within 10 days from that point in time. So your small businesses around the country are starting to see the money through their closings starting today, tomorrow, the next day. That's when the closings are starting to happen across the country. But in terms of the total volume of the loans, over $100 billion of loans have been originated and approved. That doesn't mean they've been closed. That doesn't mean that the funds have actually been dispersed, but that's coming in the next 10 days for all of those $100 billion loans. So it's going to get out there, and it's going to get out there in short order. If you're busy with that, Larry, don't hesitate to call my office, and Anthony Allen in my district office will make sure that we know cash flow is essential, and timing on this is needed. We need to get that money to you as quickly as possible. In terms of the forgiveness feature, the amount of the loan, the maximum amount of loan that you can get from a PPP loan is $10 million or 2.5 times your payroll, whichever is less. And as long as you use the proceeds of the loan for those qualifying expenses, payroll, rent, mortgage interest, utilities, insurance, healthcare benefits, any compensation of any of your workers, it's forgivable. That applies to workers that are currently on the payroll and workers that you've had to lay off but you bring back. And so to calculate the forgiveness, it's the payroll, the monthly payroll based on your prior year's payroll. So your payroll, your average monthly payroll for 2019 is how they're going to calculate it. So if you've had to lay off workers in order to get the full amount forgiven, you'll need to get your payroll number back to where it was before this crisis. And that's how you'll get the maximum amount forgiven. If you have any questions about that, don't hesitate to call Anthony in our office. We'll be happy to give you more of those details. Hope that answered the question.
Thank you. Our next question is from Marlene in Lexington.
Hi there. I've got a question for people that have to reuse their mask. See, like you've only got two and you wear one out and it's contaminated. How long does it take for that mask to be safe to wear again?
Dr. Rodrigue, why don't you take that?
Yeah.
Dr.
Now, in general, there's a couple of things. PPE, we've been working on how to use and conserve the masks, and that's a topic that has been debated for weeks now. And there's a couple of ways to deal with the amount of PPE to begin with. That is trying to decrease, increase use of telemedicine, for example, to try to not use as much PPE, to make sure we use the PPE correctly in terms of, and hopefully as we have more testing, we'll have more rapid understanding of who needs to be in PPE and who doesn't. And then there's the reuse of PPE. So the reuse of PPE, that information is based on how long do we think a contaminated mask will be contaminated. If you base it on the information that's available right now, a contaminated mask may have a virus on it for a day or so if it's not soiled. So anything that becomes soiled, whether it's patient's fluids or your body hair or something like that, we're not asking people to reuse contaminated, soiled masks. We're asking them in the setting of basically relatively clean and also functioning, say your elastic straps are working, that you put that inside the paper bag in some instances, because everybody does it a little differently, but putting it into a paper bag and leaving it alone for at least 24 hours increases the safety of using that mask. So you'll alternate. Some places are giving you 3 masks and asking you to rotate, once a day, rotating into another place. Some places are using 2 masks. But the science is basically that the virus doesn't stay on that kind of a surface for 9 days. It stays usually for a shorter amount of time so that it's safer to use your mask. Now, meanwhile, we ask you, when you're reusing masks or using a mask at any time, you still got to pay attention to hand hygiene, so that you're not touching your mask, touching your face, and contaminating yourself in that fashion. And that's a difficult piece, because a lot of us still have the habits of touching our face. So when you're putting on that mask, you still have to pay attention to hand hygiene, and you should be relatively safe in terms of using that mask. Does that answer your question?
Thanks so much for that expertise. Doctor, thanks for that expertise. And just as a reminder, and I assume this technology is sound technology, Doctor, but FEMA is telling us that they've acquired some equipment to actually clean masks. I assume that's non-soiled masks, but to the point where they can reuse masks 20 times, and 5 masks perhaps 20 times. I'm not sure every mask can be reused that much and be cleaned, but preservation of PPE is part of the solution for sure.
And the preservation, so the mask sterilization process is also being implemented now, not necessarily in every single hospital, but in the Lexington area, we are now reprocessing some of those masks through the sterilization departments of the hospital. So using hydrogen peroxide, we're able to process masks, which is a great addition to us dealing with the PPE issue, so that we should be able at some point to reprocess 500 to 1,000 masks potentially per day, and that really decreases the burden on us in terms of some of these other measures.
Thank you, Doctor. And next question.
Our next question comes from Blake, and it's an online question. He wants to know if our office is still processing constituent casework unrelated to the virus during this pandemic.
Yes, the answer is absolutely. And if you need help, give us a call. Our office is 859-219-1366. And we've got some great caseworkers, terrific public servants in our office. Obviously, they're busy with a lot of the COVID-19 related casework, but Mackenzie Todd in my Lexington office does a lot of the work with the State Department and the Social Security Administration. Jacob Bruce does a lot of work with the Veterans Administration. Alan is there as well. So give us a call and we'll see what we can do to help you out.
Okay, our next question is from Crystal in Lawrenceburg.
Hello.
Hello,
My question
Crystal.
How are you?
Doing well. How are you?
I'm doing okay, healthy. My question is in regard to the federal government has provided those on unemployment an extra $600 a week. Is there any proposal that exists regarding maybe a stimulus for hazard pay for those of us who are still working deemed essential?
There has been discussions of that, and we really thank you as an essential worker for continuing to stay working. Obviously, critical infrastructure workers like yourself are really the heroes in this situation. And so we're very, very grateful for your service. And so there's been some conversation about that, and I suspect that there may be a continued conversation. Certainly we'll take your suggestion back to me as we look to continue the effort here to support Americans who are working during these difficult times.
Okay, our next question is from Brian in Nicholasville.
Congressman Barr, wanted to thank you and your staff. I think you guys are doing a great job in this crisis, and I think everything that's been done to date so far is warranted, considering that we were dealing with something that we really didn't know a whole lot about because of the cover-up by the Chinese government and with the help of the World Health Organization. I've really got basically two requests. First of all, Attorney General Barr made some comments today about working to get the economy going again by May 1st. And I was wondering if you could reach out to him and his staff so that DOJ could issue some guidelines to our state and local leaders who are issuing these orders, reminding them that they do not have unfettered authority to infringe upon our civil rights, that there has to be a rational basis for their orders, and that it has to be narrowly tailored to what is they're trying to accomplish. And they have to have some factual basis, some medical details, scientific data to back up what they're doing, because what I'm seeing around the country is that there are a lot of places where they are far exceeding CDC guidelines, and they're going to get into a situation where this is over, that there may be civil lawsuits under 42 U.S.C. 1983 violating civil rights under color of law. So that's one request. The second request is that you reach out to the White House as they're going through this process of assessing the medical situation, and remind them that there is probably another public health crisis being created with this economic recession, that there are scientific studies out there from noted researchers at Stanford, for instance, that show that there are increases in suicides when you have this type of economic recession. And are we trading a life on COVID-19 for a life on a suicide? And that in addition, these types of economic recessions also causes increases in domestic violence, increases in mental health issues, and also increases in what I believe would be drug addiction. So that we have to take all of that into account as we measure our response and not just focus in a myopic way on coronavirus.
Brian, great comments. I appreciate it. And I did hear the Attorney General's comments in an interview yesterday where he talked about civil liberties and the need to engage in this balancing between civil liberties and the exigencies of a public health crisis. And of course, what the Attorney General pointed out was that states have broad and more plenary police powers, whereas the federal government has fewer and more defined limited powers. And that's why the federal government is engaging in guidelines as opposed to mandatory rules and allowing the states to exercise police powers. But in general, I was encouraged to hear the Attorney General talk about neutrality in the application of these quarantine rules or the social distancing rules, that as the states implement the guidelines in different ways, that they cannot do so in a non-neutral way. In other words, the Justice Department to contact state and local officials when they applied a standard to a church, for example, that they didn't apply to another secular institution. And so it's important from a matter of law that whatever rules are in place, that they apply them neutrally. Obviously, we want to get to a place, Brian, where we can reopen this economy as soon as possible, go back to normal as soon as possible without compromising public health. The last thing we want to do is open up the economy too soon without social distancing and have to come right back and do it again because we've seen a spike in an infection or another outbreak. And I want Dr. Rodrigue to talk about that, but we're definitely listening to the public health experts, and I certainly defer to some of the public health experts, the epidemiologists, but I do believe that we can get on the back end of this curve, and the goal is to flatten the curve, not flatten small business and not flatten households. And I definitely agree with you that there is a cost, not just a pecuniary cost for the taxpayer with a shutdown of the economy, but there's also a public health cost. And Dr. Fauci acknowledged that the suicide rates and the other issues and even elective procedures that are being pushed back could have some negative repercussions in terms of the wellness of many patients who are not getting those elective procedures done now and putting those elective procedures off. So there is a economic cost for this shutdown, and there is also a public health cost with the shutdown, but there's also enormous benefits to social distancing given the gravity of this pathogen. And I'll invite Dr. Rodrigue to comment on those good questions.
Brian, I think he brought up great points. That this is not occurring and the universe does not exist with COVID alone. We still have our outbreaks of opiate abuse and diabetes and chronic illnesses, which kind of coincide with the risk factors for developing severe COVID disease as well. That can't be ignored, and clearly those things have to be paid attention to. And you have competing interests sometimes, which happens in real life, where we're trying to balance the risk-benefit of everything that we do. At the government level or at the CDC or WHO level, they're always trying to fashion policies that give you the best benefit for the country, trying to take all that into account. But a cautionary tale, and that is, for example, Singapore was held out to be the best place in the world because they only had 100 cases at the beginning of March or so. And so it was in the New York Times. It was all over the place. They must be doing everything perfectly right. And then they relaxed some of their restrictions, and in a month they had 1,000 cases, and they had to start doing more measures in terms of social distancing. Look at Boris Johnson in the UK. Initially, their policy was to really try to just let it run its course and potentially have a giant herd immunity. And all of a sudden, the UK is really suffering with a big outbreak. So it's for real, and it's hard to wrap our heads around it. It's a for real thing. It does take off like a wildfire, and so they are trying to balance all the issues that you brought up: civil liberties, the economy, all those other chronic illnesses and coinciding outbreaks, and at the same try not to be Italy or Spain in terms of something that really becomes out of control and has a lot of tragedy associated with it.
Thank you,
Brian, if I could just follow up, I am confident that we're on the right track. Let me just put it that way. I think we're on the right track. We're ramping up our support for our hospitals and our infrastructure and our healthcare system with better and faster testing, more PPE, more resiliency of our healthcare system. We're on track with therapies and antivirals that are in trial right now, and there's some promising leads there. And we're going to get to a place where we're on the back end of this curve, and we will be able to implement a sentinel surveillance system where we can reopen the economy and then do this isolated quarantining, continue to practice social distancing, but let's restart this economy in a safe way consistent with public health. I think we're going to get there as we continue to fight this disease.
Okay, our last question for tonight comes from John in Frankfurt.
Good evening, John. John, go ahead. John from Frankfurt, are you on? Tatum, we may have lost John.
Hello?
Oh, there he is.
Yes. Hello?
Yeah, go ahead, John.
Yes, I have a question. Actually, two questions. First of all, I'm the sole caregiver for my son who has traumatic brain injury, and he receives SSI. He does not file income taxes, even though I file on his behalf because I have a savings account for him. Will he be eligible for the money? And
yes, sir.
Second,
yes, sir, he will.
Okay, and so does he have to file specifically? I am his legal guardian.
How does he receive his Social Security funds each month?
He receives SSI through direct deposit to my name.
Okay, that's the way you should receive the $1,200 for him. And that should happen within the next 2 to 3 weeks. If you do not see that, sir, please call us in our office. It should go direct deposit. They're telling us that the Treasury Department is telling us that if you're on SSI or SSDI or Social Security retirement, you will be receiving that direct deposited the same way you get your monthly payment now. So if you do not see that in a couple of weeks, call my office in Lexington. We'll make sure we get that for your son. And our number is 859-219-1366.
Okay, and the other question is, when you check on your income tax return on the computer on the IRS website, even though I know that I put in the correct information, it just simply comes back and says that you made an error in your submission or something. It has no information. And when I call the tax preparer, they assure me that they're getting the same thing. And one of the IRS places, I think in Ogden, Utah or something, has shut down or closed or something. And I was wondering, is it because of this coronavirus or what's the deal?
Yes, sir. I know that's got to be very frustrating. There will be a website that actually has not yet been unveiled by the department. That will be the portal where you can actually sign up. And so if you're, some people I know are trying to go on the IRS website right now and sign up, and maybe that's working for some people. But the reason why it's not working for many people, including yourself, is because they actually haven't released the website yet. And so be on the lookout. We will certainly post it on our website and our social media what that website is. Check our website. We will be putting a link to the IRS website on our website so that when that comes up, you should be able to enter into your information. Now, if you already have your bank account information on file with the IRS, what they're telling us is that within 2 weeks, you'll automatically get a direct deposit into that account that's on file with the IRS. So you won't even have to go to a website to sign up. But nevertheless, if you have any trouble with that, if you don't see payment for your son or for yourself in a couple of weeks, please call us. We want to help you get the money that is part of this legislation.
Okay, thank you. And with that, I will turn it over to Congressman Barr for closing remarks.
Well, thanks. And before I do that, let me Dr. Rodrigue, thank you so much for your time. I know you're super busy right now taking care of patients and training other physicians and healthcare providers about this disease. So would you like to have a final comment? I really appreciate your time and your expertise tonight.
I just think I'm encouraged in terms of how we're doing in Kentucky. Remember, for all those listening, that there are many people that have your back that are really trying to make things better. You don't always see them. They're the unsung heroes that sit in meetings day after day trying to figure out the best ways to do things. So be kind to them, be kind to each other. It's stressful dealing with the situation. So there is going to be an increased stress for all of us, and just to be grateful for what we have and be grateful to be living in Kentucky right now. And hopefully we'll get ahead of this thing and get it under control sooner than later.
Well, Dr. Rodrigue, great comments. Really appreciate that optimism and words of gratitude. And we are certainly grateful for you. We're grateful for your colleagues in the medical profession and the first responders and all those nurses and respiratory therapists who are in the hospitals working their hearts out right now. Our thoughts and prayers go out to you guys, and we wish you all the best health. And we thank you for what you're doing, putting your own health on the line to help other people. And thanks for the good words of suggestion to be nice to everybody right now. It's a trying time. It's a difficult time, but we do have your back. We will defeat this virus. The world is fortunate, I think, to have the United States of America leading the fight against COVID-19. Our innovative researchers, our scientists, our pharmaceutical industry, our doctors, our nurses, they really are the best in the world. And we are working overtime as public officials to support them, to find effective therapies and to combat this virus. So I encourage all my constituents to health practices for themselves and their families. I'm sorry I didn't get a chance to chat with everyone on the line tonight. I know there were a lot of questions that didn't get answered, but there will be an opportunity for you to leave me a voicemail if you just stay on the line. Hope you will leave me a message and let me know what you thought about tonight's call. Thank you again for joining us, and thanks for the privilege of representing you and fighting for your interests and values in Washington, D.C. Have a great night, and stay in touch with us on our website and social media as we continue to give you important updates in this effort against COVID-19 and the coronavirus. Thanks so much, and have a great night.